discuss about hip bone. This is the hip bone, and hip bone is known as innominate bone, flank bone, and pelvis bone. It is a large irregular bone, and hip bone is made up of three parts: ilium, pubis, and ischium. Anatomical position. For the correct anatomical position, ilium should be face upwards, pubis should be anterior inferiorly, while ischium should be posterior inferiorly. Side determination. This is the right sided hip bone. Flat expanded ilium forms the upper part of the hip bone, and it lies above the acetabulum. Acetabulum should be lies laterally, and obturator foramen lies below the acetabulum.
Parts of ilium. It has two ends, three borders, and three surfaces. Upper end, lower end, three borders: anterior border, posterior border, and medial border. Three surface: gluteal surface, iliac surface, and sacropelvic surface. Upper end of ilium is called as the iliac crest. Ends of iliac crest. Anterior end of iliac crest called as the anterior superior iliac spine, and posterior end of iliac crest called as the posterior superior iliac spine. Highest point of iliac crest is situated a little behind the midpoint of crest. Morphological divisions. Morphologically, iliac crest divided into a ventral segment, which is long, and dorsal segment, which is short. Ventral segment forms more than anterior two-thirds of crest. It has a outer lip and inner lip and intermittent area. The tubercle of iliac crest is an elevation that lies on an outer lip about 5 cm behind anterior superior iliac spine. Dorsal segment. It less than posterior one-third of crest. It has lateral and medial slope separated by a ridge. Lower end of ilium. Lower end of ilium is a smaller and fuses with the ischium and pubis at acetabulum. It forms upper 2/5 of acetabulum. Anterior border. Anterior border starts from anterior superior iliac spine to anterior inferior iliac spine. Posterior border. Posterior border starts from posterior superior iliac spine to posterior inferior iliac spine. Posterior border is marked by a large, deep, shallow notch called as a crater-sided notch. Medial border. Medial border extends on inner surface of the ilium from the iliac crest to iliopubic eminence. It separates iliac fossa from the sacropelvic surface. Gluteal surface. Gluteal surface is the outer surface of ilium, which is convex in front and concave behind. It has 4 areas and 3 gluteal lines. Posterior, which is a posterior line. Posterior line, it is shortest, begins 5 cm front of the posterior superior iliac spine and runs downward to end its upper part of greater sided notch. Anterior gluteal line, it is the longest, begins about 4 cm behind the anterior superior iliac spine, runs backward and then downward to end its middle part of greater sided notch. Inferior gluteal line, it is most ill-defined, begins from anterior inferior iliac spine, runs backward and downward to end in a greater sided notch. Iliac fossa. Iliac fossa is the largest concave area on the inner surface of the ilium, situated in front of its medial border. Sacropelvic surface is an uneven area on inner surface of ilium, situated behind the medial border. It has 3 parts: iliac tuberosity, auricular surface, and pelvic surface. Or iliac tuberosity, it is upper, large, rough area lying just below the dorsal segment of iliac crest. Auricular surface. Auricular surface, it is articular but pitted. It lies anterior inferior to the iliac tuberosity. It articulates with the sacrum to form the sacroiliac joint. Pelvic surface. Pelvic surface is a smooth surface, lies anterior inferiorly to the auricular surface. Attachments of ilium. Anterior superior iliac spine gives attachment to the origin to the sartorius muscle. Anterior inferior iliac spines gives origin to the straight head of rectus femoris muscle. Gives posterior border of iliac fibers of piriformis from upper margin of greater sided notch. Iliac crest. Outer lip of ventral segment of iliac crest provides attached to the fascia lata in its whole extent. Origin of tensor fascia lata front of the tubercle. Behind the tubercle gives origin to the latissimus dorsi muscle. Insertion to the external oblique muscle in its anterior 2/3 part. In the intermittent area of iliac crest gives origin to the internal oblique muscle in its anterior 2/3. Inner lip anterior 2/3 part gives origin to the transverse abdominis muscle. Posterior 1/3 of inner lip gives origin to the quadratus lumborum muscle. Attachment of dorsal segment of iliac crest are lateral slope and medial slope. Lateral slope gives origin to the gluteus maximus muscle and medial slope gives origin to the erectus spinae muscle. Gluteal surface. The area behind posterior gluteal lines gives origin to the gluteus maximus muscle. Area between anterior gluteus line and posterior gluteus lines gives origin to the gluteus medius muscle. Anterior gluteus line and inferior gluteus line between this area gives origin to the gluteus minimus muscle. Below the inferior gluteus line and above the groove acetabulum gives origin to the reflected head of rectus femoris muscle. Iliac fossa. Iliac fossa gives origin to the iliacus muscle. Pelvic surface which rest of the pelvic surface gives origin to the obturator internus muscle.
Pubis, it forms the anterior-inferior part of the hip bone. It has three parts: body, superior ramus, and inferior ramus. Body of pubis, it has three surfaces: anterior surface, pelvic surface, and medial surface. Medial surface articulate with the opposite of pubic. It has superior border and also known as pubic crest, and lateral end of this crest there is a one tubercle is present known as pubic tubercle. Ramus, it has three border: superior border, anterior border, and inferior border. It has three surface: pectineal surface in between the superior border and anterior border, obturator surface between anterior border and inferior border, and pelvic surface between superior border and inferior border. Inferior ramus, it unite with the ramus of ischium and form conjoint ischiopubic ramus. Attachment of the pubis on pubic crest. Its medial part is crossed by the medial head of the rectus abdominis, and lateral part gives origin to the lateral head of the rectus abdominis and pyramidalis muscle. Pubic tubercle gives origin to the ascending loop of the cremaster muscle. Anterior surface of body of pubis. Origin of the adductor longus in angle between the pubic crest and symphysis. Origin of the gracilis from the margin of symphysis and inferior ramus. Origin of the adductor brevis, lateral to the origin of the gracilis, and origin of the obturator externus from the margin of the obturator foramen. Posterior surface of pubis on its middle part gives origin to the levator ani, and laterally gives origin to the obturator internus. Pectineal line on its medial end give attachment to the conjoint tendon, and pectineus muscle originate from the whole extent of this line, and psoas minor, if present, inserted on this line. Pectineus surface on its upper part gives origin to the pectineus muscle.
Ischium. Ischium forms the posterior-inferior part of the hip bone. It consists of body and a ramus. Now, body of the ischium. Body of the ischium has two ends, upper end and a lower end. Lower end consists of ischial tuberosity. Now, it has three borders. Anterior border, which forms the posterior margin of obturator foramen. Posterior border, which is continuous with the posterior border of ilium. It consists of lower margin of greater sciatic notch, ischial spine, and lesser sciatic notch. Lateral border forms the lateral margin of ischial tuberosity. Now, surfaces of ischium, body of ischium. So first, this is the femoral surface between the anterior border and lateral border. Dorsal surface between the lateral border and posterior border. Ischial tuberosity is divided by a transverse ridge into upper area and lower area. Now the upper area is divided by an oblique ridge into superolateral and inferomedial area. Now the lower area is divided by a longitudinal ridge into outer area and inner area. Pelvic surface between the posterior border and anterior border. Attachments. Origin of levator ani muscle from the pelvic surface of ischial spine. Now, origin of superior gemelli from upper margin of lesser sciatic notch and inferior gemelli from lower margin of lesser sciatic notch. Origin of two muscles from the femoral surface. First is obturator externus along the margin of obturator foramen. Second is quadratus femoris along the lateral border of upper part of ischial tuberosity. Muscles on the ischial tuberosity, the upper area, which consists of superolateral area, it gives origin to the semimembranosus muscle. Now the inferomedial area gives origin to the semitendinosus and long head of biceps femoris. Now the lower area. Now the lower area consists of outer area and inner area. Now outer area gives origin to the adductor magnus muscle. Origin of obturator internus on the pelvic surface of ischium.